So depression can be caused by many things, and that's why it's so important to have an assessment, a careful assessment, before you consider embarking on treatment.
Dr. O'Sullivan, we've discussed clinical depression, major depressive disorder, and its symptoms and what it is. Can you get into now what causes depression?
That's an important question. There are many causes of depression. I think for me the most significant, and the one I would come across in my practice, is some type of loss. The loss of someone close to you, the loss of a partner, a husband, a wife, the loss of self-esteem. Something happens and you find that your social situation in life has dramatically changed for the worse. The loss of something that's important to you, a job, a relationship, of course, divorce, bankruptcy. So often depression will be triggered by a loss, and following the loss, the person then has to cope with the challenges and changes in life that the loss has created. So for me, loss is a recurring issue in the treatment of depression. But there are other causes. A traumatic childhood abuse, post-traumatic stress disorder in childhood will leave a person at risk to developing depression later on in life when they're facing stress or adverse experiences. Also, depression runs in families. Hereditary, or the genetic aspect. And that's been known for years. Depression runs in families, and because of that, in later life, because of that genetic vulnerability, we're at risk to getting depressed when we're dealing with a major upset in our lives. Depression may be connected to the seasons. Winter depression, seasonal affective disorder. Depression may occur when we're dealing with a major change. Even though the major change may be positive, it may create inner stresses that result in depression. Pregnancy, for example. Pregnancy and depression are known to be linked, especially postpartum depression, when the baby is born and the mother is coping with major changes in her body and at the same time having to look after her infant 24 hours a day. And finally, depression can occur and be brought on by medical illness, depression and heart disease, depression and MS, multiple sclerosis, depression and diabetes. So depression can be caused by many things, and that's why it's so important to have an assessment, a careful assessment, before you consider embarking on treatment.
There are so many causes of depression, and depression is very common in our society these days. What are the statistics on depression?
About 6% of the population at any given time will be suffering from depression. And we call that the point prevalence. So any day of the week or any week in our community, 6% of the population will be actively depressed. Also, over a lifetime, 19% of the community are likely to suffer from a clinical depression. Depression is 2 to 3 times more common in women than men. Depression rates, I should say, nowadays are escalating in teenage girls. And that, we believe, is due to the impact of social media. Women are more likely to attempt suicide when they're depressed. Men are more likely to actually die from suicide. So women experience depressive feelings much more than men. While men do not have the same rates of depression, they have many other mental disorders that they have to suffer from. So that's the difference between the sexes or the genders in depression.
Depression often gets described by people, including medical people, as a chemical imbalance. Is that a simplification of depression? Why is it called a chemical imbalance?
I think I've heard that for years. depression is due to a chemical imbalance. And it certainly is a simplification. And I think it came from the days when some doctors looked on depression as a medical condition. You had depression, you went to the doctor, you got a prescription, you took your tablets and you got better. And of course we all know nowadays that it's an enormous oversimplification. Depression, as we know, can be caused by the coming together of many different stressors. Social stressors, psychological stressors, medical issues, biological issues, hereditary. So depression is a complex disorder with complex components. And nowadays when we're treating depression, we have to stand back and take a look at the clinical picture we're presented with, the symptoms that the patient will complain of, and make a diagnosis, and based on that and based on the background, develop a treatment plan unique to that patient, to that person.
So is the person's brain actually experiencing a chemical imbalance, but the imbalance was brought about by these other factors impacting on them? Is that a reasonable
That's a good way of putting it. That's a good way of putting it, that when we're exposed to stress, especially chronic severe stress, that does impact on the brain. Now this stress may be social, psychological or hereditary, but when the brain is exposed to stress, you do get a depletion, a reduction in chemicals in the brain. Chemicals like serotonin, dopamine, norepinephrine, and these chemicals are vital for normal brain functioning. So with the depletion, by depletion I mean the reduction in these chemicals, that tips us into a depression because the brain can't function properly from a physiological point of view. So in a sense, there is a chemical imbalance, but that's just a small part of the story. The end result of many things acting on the brain over a period of time.
So if these causes that you've mentioned are part of my life or my history, for example, the childhood trauma or my genetics or other aspects, or my current life situation, if these causes are part of my life, how would I ever overcome this illness?
That's always the challenge. And that's why treatment and a treatment plan needs to be carefully designed to take these factors into account. Because one person's depression is so different to another's. So we have to look at the causes and then decide whether or not the cause can be sorted out. Is there a solution to the cause? Sometimes there is, and sometimes that is not the case. If there is a solution, we develop a plan, a problem-solving plan, if I can put it like that. If there is no solution, then we have to acquire skills to adjust to the presence of the problem in our lives. It has been said that sometimes the issue for us is not so much the presence of a problem in our life, but how we react to the problem. And sometimes our reaction to the problem contributes in large part to the problem. So adjusting to the problem, learning coping strategies, learning alternative ways of living are all part of the treatment plan.